Our next presentation asks a question. Are low hepatic mineral concentrations contributing to aborted stillborn and weak neonatal calves? And to answer that question, Robert Van Saun from the United States. Thank you very much.
Thank you, Mr. Chairman. So I want to pick up and continue with some of the information that Dr. Mee had brought to you and some of the other speakers here, talking about some of the challenges that we have in diagnosing abortions or stillborns or neonatal animals. So as we've heard already, fetal abortions, stillbirths continue to be a significant pregnancy wastage events that impede our reproductive performance of our dairy herds, which we don't need any further of that. Pre-wean mortality, as we already heard this week, is a primary cause of replacement animal losses. And as we've heard multiple times, diagnostic efficiency of these investigations, especially abortion and stillbirths, are quite low. And again, we're looking for new diseases. We look for new pathogens. And my perspective on nutrition is, does nutrition really play a role, or is it an underlying issue in many of these disease processes? I'm not the first to think about this. Some colleagues down at Texas Tech, they did some path analysis to look at what are the potential causes of natal and postnatal or prenatal deaths in beef cows, and they went through the usual things that you can see up on the screen: dystocia and weak calves and cold stress and inadequate transfer. But what caught my attention in this particular path model was they identified nutritional deficiencies and toxicities as sort of a key intermediary player in affecting all of these very significant causes of our fetal and newborn deaths. So then the big question comes back to, what is perinatal mineral status in our calves? I know we talk a lot about milk being nature's perfect food, but in reality, milk in many of our farms that are moving to whole milk feeding is very deficient in many of the trace elements. And I always wondered how we as a mammal species could survive by consuming a food source that is basically deficient in some critical trace elements or critical nutrients. And part of that comes into how Mother Nature has set things up. They set up a system where these trace elements can be very efficiently transferred across the placenta and concentrated in the fetal liver. Now again, depending on whether you're measuring your trace minerals on a wet weight basis or a dry weight basis, which is how I'll present my data, we do see this concentration effect. We also see that colostrum is unique from milk, not only because of the antibody level, but because trace elements can be highly concentrated in colostrum. But both of these practices, or both of these mechanisms, are critically dependent on maternal nutrient status. So feeding the minerals to our pregnant cows, some of the things that Dr. Mee had talked about, going back to looking at iodine, selenium, and some of those issues. So what I wanted to do was start to set the stage to look at, is nutrition a player here? And I did some retrospective analysis of a number of populations of data that I had collected over the years. I had a number of fetal abattoir type samples that I'm going to call my control samples, although we could question whether or not fetuses from pregnant cows going through the abattoir are actually normal. I had a database of fetal abortion cases that went through our diagnostic laboratories. They chased the bugs as usual, and as you might guess, most of the results came up with no known diagnosis. And then I'm currently in the process of looking at stillborn cases. And again, from what Dr. Mee had suggested, my definition of a stillborn was greater than 260 days of gestation, and I terminated at about 6 hours post-calving. And then I have another database of neonatal mortality. So these are young newborn calves up to about 2 months of age that had died on farms. So I went ahead and determined all the trace minerals in these livers from these samples and looked at these populations in comparison to try and identify is the potential for nutrition playing a role or some mechanism in these losses. So just to show you, I had 185 different abattoir samples. These were both beef and dairy. Abortion samples were 106, although a portion of those abortion samples probably should be included in the stillborns because they were samples that I was attending a dystocia and that the calf had died during that process, so I took advantage and took the liver from that sample. My current stillborn samples and then the neonatal samples. As I mentioned, the abortion, the stillbirth, and the neonatal mortalities, all of those cases went through a diagnostic laboratory, had many of the parameters that were previously mentioned, crown rump length measured, weight, body weight of the animal, as well as gross physical abnormalities, and then a full necropsy post-mortem performed to look at any congenital defects, as well as all the microbiologic issues that we would follow up with. Now, unfortunately, my databases were not selectively collected to balance for dairy and beef, since these were just samples as they came through the lab. So I did use dairy and beef as a covariate in my analyses that I'll talk about in a moment here. So the liver samples were analyzed by ICP technology. Some of the samples were measured by atomic absorption emission. That was some of the older samples, currently with mass spec, but they were measured. All samples went through the same diagnostic laboratory at Michigan State University. You can see the list of minerals I did include in this database to show you, because I'm intrigued by some of the differences that I found in calcium and magnesium. These are obviously not trace minerals, but we never really looked at those. We really don't even have normals for fetuses on those two macro minerals. But as you'll see in a moment, there were some significant differences in those nutrients. All the minerals were analyzed on a wet tissue basis, and then we measured dry matter content and converted to dry weight. The reason being is the dry matter content of the liver changes over gestational age. It's fairly well proportional to gestational age, and it changes over neonatal age. So it's an ever-moving target, and so to compare these numbers across these different age groups, we certainly need to look at them on a dry weight basis. What I did then for the comparisons is, if we identified a specific pathogen, whether it be related to lesions specific to that pathogen or pure cultures, that was identified as an infectious cause for either the abortion, stillbirth, or neonatal mortality. If there was some identified physical defect, like a ventricular septal defect or something along that lines, that would be in the congenital group. Dystocia was just a stillbirth, essentially, during the birthing process from the history. And then we use the term idiopathic as we don't know. If we don't know the cause, then it's an idiopathic abortion or idiopathic stillbirth. So in terms of looking at and comparing these populations, it's a very heterogeneous process. I identified main effects as just the source, whether they're abattoir, the abortion, stillbirth, or neonate. Then, of course, dairy or beef as a breed, male, female as a gender, but that fell out. There was no significant differences to gender. And then disease status, none would be my control group, which is the abattoir group, versus the infectious, dystocia, or idiopathic. And then compared fetus versus neonate in terms of collective age groups, and then looked at all the interactions. Looked at mineral analysis, had those model effects and their interactions, and again, I used breed as a covariate to adjust because breed was significant. Beef breeds had very different mineral values than dairy breeds, and of course, this is a function of the grazing situation, lack of mineral supplementation, and more intensive mineral supplementation in the dairy side. So just to show you some snippets of some of the information, here's the breed effects. You can see quite a number of nutrients. Right off the bat, you see calcium was different in the minerals or in the dairy breed, higher in the dairy fetuses and neonates. This is across all groups now, versus beef. Magnesium was not different. Cobalt was not different, but then you can see copper was highly different, higher in our dairy breeds. Iron was higher in our beef breeds. You might assume that with the grazing scenario, and so on down the line here. Notice also that for those of you in the back, zinc was very different and selenium was much higher also in our dairy breeds versus the beef samples. So if we look at the source effects, okay, this is, again, collectively, doesn't matter what the diagnosis was, this is just looking at abattoir samples versus abortion samples versus stillbirth samples versus the neonatal samples. And you can see here in abortion samples, calcium was significantly higher than any of the other samples. Magnesium was high in the abattoir samples and the neonatal samples and much lower in the abortion and stillbirth samples. We had differences in cobalt, copper. Again, the abattoir samples were much higher in copper compared to abortion and stillbirth samples. Iron was also higher. And then we can see selenium and zinc were higher in our abattoir samples. So there was a number of very significant nutrients that we would consider that were very different in the abattoir samples compared to at least the other abortion and stillbirth, the other fetal samples. When we start to look at the differences in these numbers across diseases, so again, remember the no disease is my abattoir samples. And then I have infectious. This would include both infectious abortion, stillbirth, and postpartum, and then idiopathic, and then you can see the dystocia. And one thing I want to highlight here is if you look at some of these numbers, like for copper, notice that the copper concentration is the same in my abattoir fetuses as with my dystocia fetuses, but much lower in the infectious and idiopathic samples. So again, does this have some impact on immune function or other interpretation? We also see that zinc is much higher in our abattoir samples. There were some interaction effects. Copper was one where we saw this interaction of the source, whether it was abattoir, abortion, stillbirth, or neonate, and disease status. So there's a lot more coming out on that. Iron and manganese was also, those three had very significant interaction effects. And then a source by breed interaction was found for calcium, for copper, and then for zinc. So just to show you some plots here, this is only looking at the stillborn calves. And here I have copper, magnesium, and zinc as my three nutrients that I'm showing. And then the bars represent, the blue bar here is the abattoir samples. This is infectious stillborns, idiopathic stillborns, and then the dystocia cases. So this is only looking at those late-term fetuses, comparing them to my abattoir fetuses. And again, we see some fairly significant differences. Interesting, the very low copper in our idiopathic stillborn cases, and again across the board, our infectious and idiopathic cases had lower concentrations compared to the dystocia and the copper, or excuse me, the abattoir samples. Looking at the shaded area is what's considered the normal range for the Michigan State University lab. The red is considered the very deficient line, and so I just put this up to show that we got a long ways to go to determine what reference ranges are. So we can measure these things, but the question is, how do we interpret them? And we need good reference values for interpretation. That's the problem across the labs. Not a lot of age-based criteria and so on. Looking at some others, this is on the neonatal calves. Notice that the infectious causes had lower iron, some differences in manganese, and also some slight differences in copper. If we look at the infectious disease comparisons here, again, we see this very high level of calcium, lower level of copper, lower levels of magnesium in both abortion and stillbirth infectious causes, and also very low zincs in abortion and stillbirth infectious causes. Again, just highlighting those normal ranges that we at least feel comfortable with some of those, but obviously zinc is way out of whack. This is looking at manganese and molybdenum, interfering substance. And then looking at idiopathic, we see some very different values, much lower values for many of these trace and macronutrients for our stillborn and abortion cases that we have no diagnosis for. Selenium comparisons, we see the lower selenium concentrations, which most of us would assume. So what does this mean? What are the potential? This is not a cause and effect study. This is just a survey, no implications. But we do know that the trace minerals are heavily involved in immune function as antioxidants and metabolic functions. There's other inhibitors to these. We don't know much about calcium and magnesium in their role. And there are some observed differences, and these are pretty consistent from what I've seen over about 20 years of measuring these. So I think there is some opportunities to be looking at this. I think these differences in these trace minerals between calf populations suggest that there may be a role for trace minerals, whether it's an initiator of a process or a direct effect. We still don't know. We do need to better define our data for hepatic mineral references so that we actually can interpret these numbers and provide that information to our clientele. Dietary mineral status in the mid to late gestation cow must provide enough of these trace minerals to ensure this. And the bottom line is we really need controlled feeding trials to actually confirm a cause and effect relationship. With that, I want to thank the diagnostic labs I've worked with and Pennsylvania Department of Ag for support of this. Thank you.
Thank you very much, Dr. Van Saun. If there's anybody that has an urgent question that they want to speak with, ask Dr. Van Saun. We'll take one. We're just over time. Or if there's anybody that wants to ask a question to him afterwards, I'm sure he'll oblige.
No, I'm here.
So just on behalf of you, I'll thank Dr. Van Saun again. Thank you very much.